Welcome to this week's installment of Take 5, an inventory series, where we deliver to your door the healthcare news of the day as contactless and socially distant as we possibly can. I'm Alex Diamond, and I am a liar. I said last week that we'd be discussing institutional change, but I ran across so many conflicting reports about hospitals' need for PPE that I asked equipment procurer extraordinaire Carl Nanstead to weigh in on why some hospitals might actually have more than they need.
The demand curve has been somewhat regionalized, just like the outbreak of the pandemic itself. So while hospitals all across the country were, bulking up or buying up in order to meet what they anticipated demand would be for PPE supplies, clearly during the highest peak of the pandemic, those supplies were being consumed the fastest in areas like New York, New Jersey, Connecticut, et cetera. And what we're seeing now is a shift. And that shift is, again, being driven by the prevalence of the virus in various regional localities. So in New York, as an example, where we had probably the peak demand and was really driving all kinds of PPE sourcing activity, we're now seeing some of the lowest new case rates. So some of that PPE demand is shifting to new places. I have clients in Maryland, for example, that are in dire need of isolation gowns, masks, and other PPE supplies. So I think one thing that's happening is the demand for PPE is kind of following the virus itself. The second thing that's happening is various hospital systems around the country have prepared at different levels. And in some cases, this might be driven by a number of different factors. For example, do they have adequate cash reserves to buy up enough supplies and sit on them? Do they have a facility where they can store them? We're working with a couple of very large health systems, and they're run their own distribution warehouses, and those warehouses are full of PPE supplies, perhaps much more so than they'll ever have demand for them. So many health systems bought so much PPE at such a frenetic pace that they've in some ways kind of lost track, I'll call it, of what they actually currently have. And so we're using our tools to help hospitals and health systems get a handle on what they currently have. We're also using our tools in secondary market to actually help some hospitals liquidate excess PPE that they bought in anticipation of a much bigger COVID surge than they experienced. So I think we've seen kind of the market come full circle, and Z5 definitely has a role to play in helping clients to just manage that inventory and consumption of that inventory and make sure they get the maximum value out of the money they've spent on it.
So that tells us about hospitals, but what about the suppliers themselves? Have we seen improvement there?
I believe that some of the traditional suppliers were hamstrung in their ability to respond because of the contracts and pricing structures that are so rigid and in place, both through group purchasing organizations and also directly with hospitals. And so what happened is those contracts literally prevented traditional suppliers from perhaps going and accessing some of these other manufacturing sites because they could only sell at a fixed price. And the non-traditional suppliers who had no contracts or were not bound to any previous structure just could come in and leverage the market and be able to operate and sell PPE at what we saw were extremely inflated prices. And I think there's kind of two things happening there at the same time. One is traditional suppliers are catching up with the demand in some cases and are beginning to be able to meet some of the demand from the health systems without the non-traditional suppliers. The second thing that's happening is a lot of folks who thought it was easy money or something easy to go do and jumped into the non-traditional supplier pool are now realizing it's a lot harder than it looked in the first place. And so they are returning back to their prior businesses and stepping out.
That's this week's 5 Minutes. Come back next week when we talk to Carl again about preparing for a second wave. Take 5 is a production of Z5 Inventory. To see all of our sources and resources, go to z5inventory.com. That's the letter Z, the number 5, and the word inventory.com.